as well for employees who are vaccinated but want or need to be tested. So we'll be doing both testing and vaccinating. This week is both Climate Week and Clean Energy Week, and today is also Car-Free Day in Montgomery County. World leaders are going to gather at the United Nations on Friday for a meeting on climate and energy issues. The magnitude of this climate emergency requires all hands on deck approach from all levels of government and society worldwide. And Montgomery County is one of many jurisdictions around the world that have submitted an energy compact to the United Nations this week. The energy compacts are commitments that are made by nation states, companies, local governments, nonprofits worldwide to advance the progress on the UN Sustainable Development Goal, which aims to ensure access to affordable, reliable, and sustainable and modern energy for all. Montgomery County's Energy Compact highlights the vision of our climate action plan and the actions that we must take between now and 2035 to advance progress toward zero greenhouse gas emissions in the county. I was happy to do a program with 3 other county executives that aired last night, and that addressed what all of us are doing in our different counties to address climate change. And one of the good things that comes out of meetings like this is some of us do things that others aren't doing, and it's a good chance to learn what some of our counterparts are doing so we can incorporate them into our plans of action, as well as show them what we're doing and give them the ability to see what other possibilities they might have. So as the saying goes, we need to think globally and act locally. I'm very proud of the climate action plan that we released in June. It's a strategic plan that outlines the path for the county to reach our climate goals to eliminate greenhouse gas emissions by 2035. The climate action plan also discusses the effects of a changing climate on Montgomery County and outlines strategies to reduce our climate-related risks. And it also addresses concerns about what happens to the most economically vulnerable communities in Montgomery County as we need to move forward on climate action. We have to be aware that things we do that may increase the costs, for example, to apartment buildings in order to come into compliance, that without steps to mitigate the effects on many of the residents, we may find ourselves displacing people, and that would not be an acceptable outcome. So we're aware of what we need to do to couple both climate action with consciousness about who gets affected. Our approach in general is that this document is going to be a living document. It's going to continue to be revised annually as new technology becomes available and as we identify additional sources of funding so that we can expand our implementation efforts. Earlier this month, Hurricane Ida and the deadly after effects of torrential rain, flash flooding, and tornadoes brought climate change front and center here and around the country, even as we continue to grapple with COVID-19. Due to climate change, these storms are bigger, more intense, and more destructive year after year. I was out at the site of the apartment flooding, and this occurred somewhere around 3:30 in the morning when people were sleeping, and the water came in under their doors and gradually built up in their apartments. When I visited the scene, you could see watermarks that indicated 6 feet or more of water likely was inside the apartments. So it's a miracle that only one person lost their life, one too many. But it's also evidence of what it is we're dealing with. It was a pretty small stream that managed to discharge that much water and overrun the pipes that it fed into that actually led to that flooding. But we can't reverse this trend. We know we're not going to be able to do something that turns it around, but we can slow down the deadly impacts and we can minimize the long-term extent to which climate change grows. This is not going to happen simply by wishing or praying for it to get better. We need smart policy and the political will and courage to make tough decisions. I want to highlight a couple of important climate policies that I sent to the County Council in the spring to address emissions from new and existing buildings. These are the policies are also part of the Climate Action Plan. One is the Building Energy Performance Standards legislation, affectionately referred to as BEPS, that will require owners of the largest and most energy-consuming buildings to take action to improve their buildings' energy performances. The other is the adoption of the International Green Construction Code, which will require new buildings to use less energy, generate more renewable energy, and create healthy spaces for our residents. And last weekend, Montgomery County hosted the world's largest electric vehicle car show in Poolsville. This was a great event, and it was evident by the attendance numbers, participants, and companies that were involved in this that the residents of Montgomery County and the capital region are interested in products that are sustainable and environmentally friendly. We're also in the market as a government. At this car show, we showed off our new police EV cruiser, one of hundreds of new vehicles, eventually thousands of new EV vehicles that we will be purchasing across our county fleet. You can see me here beside one of the police vehicles. We're actually working with Ford to help them figure out the logistics to make sure this can serve as a full-fledged police vehicle, and we're optimistic that we will get there. It's great progress, and we have a fleet of vehicles that we can turn over that would make a large contribution to reducing our greenhouse gas impacts. I was also proud to have pulled together the deal that's making it possible for MCPS to transition its fleet of diesel buses to electric buses. This is another significant step forward, and we're continuing on our own to electrify our ride-on fleet, as we talked about a couple of weeks ago at the groundbreaking for the smart energy grid at the Brookville Bus Depot. And that effort will also be complemented by adding clean hydrogen vehicles to that fleet. I'm going to ask Adriana Hochberg, the county's Climate Action Change Officer, to join us today. She can update you on the progress we're making with implementing the Climate Action Plan. I think with that, I'll turn it over to Adriana.
Thank you, Mr. County Executive, and good afternoon. The County Executive has framed it well in that tackling climate change requires global thinking and local action. Yesterday, I had a chance to participate in a Climate Week NYC event. U.S. Climate Envoy John Kerry participated, and he said that the consequences of this decade's choices could not be greater. Another participant was Alok Sharma, who is the president designate of the upcoming UN Climate Change Conference, or COP26. And he said that this is going to be the decisive decade for climate action. He added that the window for keeping the goal of 1.5 degrees Celsius alive is closing. Bill Gates also sounded the alarm at the event. He said that addressing climate change will be the hardest thing that humanity has ever done. We're tackling some hard stuff right out of the gate here in Montgomery County with implementing our climate action plan. Our sleeves are rolled up already. And just give me one moment to fully finish sharing my slides here. As the county executive mentioned, we already have the Building Energy Performance Standard Bill, as well as the 2018 International Green Construction Codes. Those are currently before council. As well as we have the Transportation Demand Management Regulations undergoing public comment period. These regulations relate to expanding the use of transportation demand management across the entire county. The General Assembly recently authorized a community choice energy for Montgomery County, and the work group hosted by the Public Service Commission that will establish the regulatory framework for that program kicked off earlier this week. We also have some additional climate legislation that's currently being drafted, including authorizing the Montgomery County Green Bank to expand its scope of work to also be able to undertake resilience-related activities. We're also looking to expand the commercial property assessed clean energy program to also be able to be used as a tool for more resilience-related efforts, as well as we are drafting a ban on the use of gas-powered leaf blowers. We have dozens of climate actions underway this year. Listed here is a subset of them. I encourage you to take a look at our fiscal year 22 climate work plan for the full list of 75 actions that we have going on. I'll mention or highlight just a few of them here for you. With regards to climate budgeting, we have been working very closely with the Office of Management and Budget to incorporate climate lens into the county's budgeting process, including both the operating budget as well as for the first time this year, the CIP budget, in terms of questions that departments are being required to answer when submitting project proposals. We are also developing different models for engaging with our community on climate issues. We're conceptualizing what a community justice academy would look like to involve vulnerable members of our community who would be co-creating climate solutions with the county that are relevant to their neighborhoods. We also have recently launched the Climate Stories Project, whereby community members are encouraged to write stories and videos, take videos of their firsthand experiences around climate change. As the county executive mentioned, there's a whole host of things in the works in the transportation sphere, in the clean energy sphere as well. We are partnering with the National Renewable Energy Lab in order to enable Montgomery County to be the first test site in the Mid-Atlantic for an agrivoltaic study that would be co-locating table crops underneath and next to solar panels. The county executive mentioned that the county has submitted our energy compact to the United Nations. You can find our full submission listed here on this URL. The energy compact submitted by Montgomery County reflects the commitments and the actions that were outlined in our county's climate action plan. And finally, today is Card-Free Day. If you have not yet left your home, it's not too late to make it a card-free day. And to underscore the link between the importance of using different modes of transportation to our climate action plan, in order to meet our climate goals by 2035, we're going to need to reduce the share of trips by private vehicles, and we're also going to need to double the proportion of bus, rail, and bicycle trips, as well as walking. Well, thank you.
Thank you so very much to our Climate Change Officer, Adriana Hutchberg. And now it is to you, Dr. Bridgers, for your update. Good afternoon.
Good afternoon, and good afternoon all. Happy to give another update, COVID public health update, in addition to Mr. Elrich's update on the numbers. We continue to administer CDC-approved third doses, shots in the arms of those individuals who are homebound and have indicated that they are immunocompromised, along with those markers as having, over the last couple of days, the lowest test positivity or case rate. We have the second highest number of individuals who are homebound who've been vaccinated at 733 persons, and we still continue to administer those shots both at home and at our three areas. We continue to monitor the hospitalization data. Data indicates that we're trending downward. We don't see the increased number of ICU beds or the acute care beds as some of our neighboring jurisdictions may have experienced out in Western Maryland, Southern Maryland, or Eastern Maryland, respectively. And so we continue to monitor the data regarding post-vaccination or outbreak cases. Again, over the past 4 weeks, we've, based on our data counts and our data feeds, we have 3,543 cases. Of those cases, about 39% or 1,389 were vaccinated. Of those vaccinated, a smaller amount, 4%, about 150 of those cases, 49 were vaccinated. And so we continue to look at the data trends regarding those unvaccinated, vaccinated persons. We know that most of the unvaccinated cases have been in those individuals who are 18 and under, who are either eligible for vaccination or there isn't a vaccine available for our 5 to 11-year-olds. And we continue to monitor the data and what the pharmaceuticals are presenting either to FDA or the CDCs for emergency use authorization, and prepare for those vaccinations in those approved spaces such as 65 years and older, which is being considerized, under consideration, I have to say, and those individuals who are 5 to 11, waiting on the data and looking at the syndromic and surveillance data. For that, lastly, the hospitalizations we see along the data trend lines of those individuals who are 50 and older, and those individuals may have had underlying health conditions. Lastly, we continue to work with our MCPS and independent partners to ensure that we identify those individuals, those school-age children who are symptomatic, and to quarantine them. What we're seeing now is we aren't seeing as high rates based on our robust rapid testing point of care strategy that we recently employed, and we continue to monitor that on a daily basis and have conversations with MCPS to look at the most effective measures to keep our students in school. I'll stop there. Lorna, subject to any questions.
Thank you, Dr. Bridgers. And we do have some questions already. Reporters, remember to use the chat to request your turn to ask questions. And the first set of questions is coming from Kate Ryan at WTOP for the County Executive. Good afternoon, Kate.
Good afternoon. Sorry, on the unmute, I keep reaching for that little red mic. I have a quick question about the 30% of the cases of COVID being children or young adults between the ages of 0 and 19. And again, Dr. Bridgers, you just kind of gave us a little overview, but are there particular clusters? Is this school exposure? Can we tie it to anything? And again, these are confirmed cases, right? This is not exposures.
These are confirmed cases, Kate, and thank you always for your questions. And so what we're looking at what MDH is reporting. And the information that I recently received was that individuals who were 18 and under and who were unvaccinated, now they didn't identify any cohorts of whether or not they were school-age kids and whether or not they were what particular age range. And so what we're seeing is in our population and what we're working with MCPS is those individuals. We had 3 cases reported yesterday in the elementary school and 1 case in the high school. And so we continue to monitor the case rate on a daily basis. But what we're seeing is those individuals who are either unvaccinated and eligible to be vaccinated, or those individuals who are school age. And so that's what the data is showing us right now based on the report that I read this morning.
Gotcha. And just so I'm clear on those who are eligible, the 12 to 18, do we know what proportion of that 30% belongs to the 12 to 18? Is that a case of either refusal or access or parental issues? Do we know anything further on that?
Well, we aren't seeing a lot of refusals at the school age, at the elementary school or school age. But what we're seeing is we still have some vaccine hesitancy from those individuals who are eligible to receive vaccination. Some may be apathetic, and what we've been doing to address some of these challenges have been to provide more information on what the data, science are saying regarding the efficacy. So as far as a particular cohort breakdown, I don't have those numbers currently, Kate.
I appreciate that. And for the county executive, on the employees and the reporting to the survey, there's an interesting distinction in the way Montgomery County reports it, because the percentage of folks who have simply not responded, it doesn't mean they didn't get vaccinated, it just they haven't responded. But you still have high numbers, 34% of fire EMS, 30% of corrections, and 22% of DGS. Do we know why they have not responded?
They have not written us notes explaining why. We are actually working with the unions who are going about and addressing this at an individual basis and finding out whether people thought that they had taken a test with the county, that they'd maybe been tested on site and assumed we had the information and it didn't apply to them. We know that the more they've talked to people, the more they've found folks who were already in the category of being having been vaccinated. But we'll know better after these folks have worked it over for about a week. But they're doubling down because they want to get their numbers down. It's an issue not just for those who may not be vaccinated, but then it becomes an issue for their coworkers around them.
Exactly. And then in the not vaccinated category, the department with the highest number of people who have declared they are not vaccinated is in Department of Transportation, I'm assuming that means people who may be front facing, like bus drivers, et cetera. Again, do you have word from Department of Transportation as to why that's the case?
So, I mean, people really aren't getting the why from people. I mean, the form didn't ask for what's your attitude to vaccination. It just collected, are you or aren't you? And what we're trying to do now is follow up with people and double down on trying to educate them and inform them about why they need to get vaccinated.
Understood. And then do we know what proportion of these people in these categories live outside the county? Because as you said, the county has an extraordinarily high rate of vaccination. They've, considering the size, it is pretty astounding.
Yeah, I mean, there are a fair number of people. I don't know about corrections, but I know fire and police to some extent have a fair number of people live outside of the county.
Got it. Thank you very much. I appreciate it.
Thank you, Kate. The next question comes from Brian Rembaum, MarylandReporter.com. Good afternoon, Brian.
Good afternoon. Thank you. I just have a quick question for the county executive. Montgomery County, has continued and consistently leads the state with its vaccination metrics. I was just curious as to what factors do you attribute, the county's ranking in that regard?
But I think a couple of things. One is we've always done these press briefings and heavily engaged our health officers, and we've consistently put out a health-based message. And most of even what I've talked to, particularly, in the height of all this, has been related to COVID. So I think we delivered a pretty consistent message to the public. And I think we made it very clear that we weren't playing political games. You didn't see us waffling and making different decisions based on public pressure, which just contributes to people thinking like you're not serious about this, or the story changes every day. This story did not change from beginning to now. It's been the problem that it is. It's transmitted by people. It doesn't float around for any length of time if it doesn't have a human host, which means that anything we could do to cut down transmission and contact were the things we were going to do. And I think people understood that because we were consistent. And I think we took a lot of time, explaining this to people. We just didn't say, here's an order, but we tried to frame it in a scientific setting so that people understood what the reasoning was behind the orders. So I think that doing that and being consistent was really, really helpful. And going to the people, and we do this every week, and I send the message home every week. So people are getting a consistent message, and I get a lot of comments from folks about the value of that. So I really think that people, if they feel like they're getting reliable information and consistent information, are far more likely to take it seriously than they think if they think this is a political football.
Thank you, Brian. Next set of questions. They're coming from Steve Bonnell, the best upbeat, for you, Dr. Bridgers, and also for Climate Change Officer Hochberg. Good afternoon, Steve.
Good afternoon. Dr. Bridgers, I'm sure you've been paying attention to kind of recent actions by the FDA that ruled, third boosters are okay for people 65 and older, but not at this point for the general population. We all can see the headlines, but I imagine that you're a little more plugged in on why those decisions were made. And I just wondered what your perspective is on that, and also how concerning that is, or perhaps not concerning that is. Obviously, you guys were anxiously waiting, what the FDA was going to say on that matter.
Sure. Thanks, Steve, for those questions. So yes, we have our syndromic and epi team and our surveillance team and our uniformed services, public health officer service corps, which are the medical interns that we have here to look and track at the data. We look at the efficacy of the data. We look at the dosing. We look at, the use for those individuals. And so we look at what the data and science has said over these past 19 or 20 months. And we know that there are indication or indicators that say that suggest that as an individual is older, they may be more susceptible to COVID-19, even if they have been vaccinated. Waning is the term that the scientists are using. And so we were not surprised that based on the data that Pfizer submitted, that eligible population would not be the first population to be approved. If you think back, if you rewind maybe 10 months ago or even 9 months ago, we started off with our healthcare and our public health officials. Then we moved into the population that was the most vulnerable, which was our senior population. And we know those individuals may have experienced chronic illnesses over their lifespan or their life trajectory to where they may be more at risk or at greater risk for the transmission of COVID-19. Conversely, we're looking at the under-vaccinated population and anxiously awaiting for an approval, most likely Pfizer, but we don't know, based on the clinical trials that were submitted for the 12 to 15-year-olds. And so we're looking at those unvaccinated and those chronic illnesses, those age categories where we see folks most at risk and most vulnerable. And so those are some of the data points that we continue to look at. We continue to look at those areas in the county where folks may have access or there may be equity challenges. And so these are some of the strategies that we look at specifically. And it's a little more than what your question asked, but I wanted to provide more detail around the strategies and the approaches that we use to look at the data and the science. And as soon as it's reviewed by FDA and approved by CDC, ACIP, we have mechanisms in place that we're able to adjust. If you recall, when we talked about the guidance, maybe about 3 or 4 weeks ago, about having once the third shot was approved for those individuals who were immunocompromised, we had our plan in place. And once we received authorization and guidance from the Maryland Department of Health, we received notification on Thursday evening, and by Friday morning, we were administering shots in arms. And so we continue to look at and track those data trends. Lastly, we've begun to look at those individuals who've received shots in the county based on our partners and what we see in the data systems to identify those individuals who are 65 years and older, to look at those individuals, the type of vaccines that they've received based on their approval and authorization in anticipation of administering a third shot, and then where they lie outside of those windows, whether or not it's 8 months, whether or not it's 6 months, so that we can begin to strategically target those individuals and make the announcements and have those vaccines available. So I hope that answers your question.
No, I appreciate the lengthy response. I guess to follow up on that last point you made and using the term you used, waning, there's been a lot of debate on when people should get a third dose, if it's 6, 8 months, 10 months. What's your perspective based on the literature and data you've been looking at in terms of, I'm sure it differs from person to person. What's your perspective on that, I guess?
So based on, first and foremost, individuals should consult their primary care providers. Again, when we started vaccinating folks in the county, providers didn't have access to 3 or 4 months after we started vaccinating. Now providers have access to the vaccines, pharmacies have access to the vaccines, and hospitals have access to the vaccines. But first and foremost, individuals should consult their primary care physician. And then the 8-month period post being fully vaccinated, being 2 weeks after you receive your second dose of Pfizer and Moderna. There hasn't been any discussions, although there are clinical trials and data analysis for Johnson & Johnson out there now, because we are starting to look at the data regarding what the Johnson & Johnson is saying for their second shot as compared to the boosters. And so individuals should look at their vaccine cards to determine what that 8-month window is. Continue to monitor our websites regarding the availability and what the CDC and what the federal guidelines are suggesting, and we will help them. We will have that information. We've continuously updated information on our website. So my take on it is individuals should contact their primary care physician. They can look at their vaccine cards, and they can kind of gauge when they should be eligible if they fall within that approved age bracket to receive a booster shot.
Thank you. And Ms. Hochberg, kind of on the climate action plan, I know a piece of this that's kind of long-term, but at this point it's the Community Choice Energy Pilot Program. I know we're early on in the process and kind of looking ahead, we can't propose anything locally for a bit here, but what's your perspective on what that legislation might look like, or any policies, and how important that is overall to the climate action plan?
Sure. So Montgomery County's goal of getting to zero emissions by 2035 is 10 years earlier than the state's goal of getting to zero emissions. So absent state taking more aggressive action at the statewide to green our electricity grid, clean choice, community choice energy is an important action for the county because it will give the county the ability to purchase more renewable energy on behalf of our community members. There is still a long road ahead, as stipulated by the General Assembly legislation that passed this session. There is going to be a multi-year regulatory convening, that's being hosted by the Public Service Commission with multiple parties that will hopefully collaboratively, come up with the framework for how community choice energy will run in Montgomery County. So there's still a little bit of have a road ahead of us. The authority for Montgomery County to launch this program, we're prevented from launching it prior to 2024. So we were going to use this lead up time to plan and be ready to go, when the time comes.
Do you think, I know Councilmember Reaver during the council meeting yesterday mentioned President Biden's comments about, solar being a big part of going to green energy. Do you think that's going to drive, how you guys deal with this community choice program, given that the federal level is kind of saying, hey, solar is the way to go here in some respects?
Yeah, absolutely. We're going to be looking at solar, wind as well. There's prospects for offshore wind in Maryland, as well as prospects for tapping into renewable energy, outside the boundaries of the county. We're going to be looking at, all of the above.
Thank you very much.
Thank you, Steve. Next set of questions, Jordan Lindsay, my MCM, and I believe there are for you, Adriana.
Thank you.
Good afternoon, Jordan.
Good afternoon, Lorna, and thank you so much, everyone. Ms. Hutchberg, I just wanted to know, I know you're early in the process in regards to climate change and all of that, the plans you guys have here, but are there any specific areas in Montgomery County that might be more impacted by the results of climate change compared to others that you can foresee at this moment?
Yes, through the development of the Climate Action Plan, we did some mapping analysis using the CDC Social Vulnerability Index, which looks at 15 different factors of social vulnerability, including households that speak English less than well, that have less than a high school diploma, and so on. And so we were able to map and highlight the communities in the county that are the hotspots in terms of social vulnerability. And we believe that it's those households that are the most socially vulnerable that are also most vulnerable to climate change. And we want to be able to use the results of the mapping analysis to prioritize our work on the ground to benefit those communities first.
Is it lack of resources that they might have that makes them more vulnerable than others? What makes them more vulnerable, if I might ask?
Yes, so it's lack of resources is definitely one, lack of access to information, high energy burden is one of them. So they're spending a lot of their monthly take-home pay on, utility bills. So they don't have the flexibility, for example, in a hot summer day, perhaps they don't have the ability to keep the AC running all day long. So they may be more susceptible to, health impacts on a high heat day, for example.
Got it. Thank you very much.
Thank you, Jordan. Next set of questions, Jack Moore, WTOP, for the county executive, and also for you, Dr. Bridgers. Good afternoon, Jack.
Good afternoon. Thank you. Quick question, follow up on the 30% of cases involving those under 18. I'm curious, Dr. Bridges, if you can tell us kind of what the time period for that is. Is that over the past week or past few days, or kind of what 30% of cases over what time period?
Yeah, thank you for the question. And what I'm tracking is the data that I received last night, and it's over the past 4 weeks. So from August the 23rd through September 19th.
Thank you. And I'm curious if I heard the county executive correctly that it's also about 30% of cases in Montgomery County are under 18. Did I hear that correctly?
Yes.
And I'm curious if you can provide any other breakdowns, age breakdowns for cases. I have to imagine with the high vaccination rate among the older population that it's smaller, but do you have that breakdown of, 0 to 19 is 30%, and then kind of the other breakdowns?
Absolutely. So for the past, and I'm looking at the data as we talk. So about 513 of those cases by age have been 0 to 9. About 535 have been 10 through 19, and about 562 have been 20 to 29. The next highest category is 30 to 39. And so that's the breakdown that I have based on a full 4-week total. Less than 10% of those categories that I mentioned between 0 to 9 and 10 to 19 have been identified as hospitalizations. We see 35% of our hospitalizations being in individuals who are 60 to 80 plus.
Okay, so that's important. I don't want to scare people if we say 30% of cases involve people under 18. So you're not really aware of hospital or many hospitalizations for those under 18.
No, that's correct. We haven't seen the number of pediatric cases, those individuals who are presenting for respiratory illnesses, or those individuals who are presenting for COVID-19 flu-like symptoms. And so that's great. Again, we look at the transmission rates, and we haven't seen those cases, as some jurisdictions may have seen. We continuously monitor that. We know that individuals are returning to school, individuals who are school age, and there are interactions more than they may have experienced a year ago, and they may have viruses and illnesses, but we aren't seeing those numbers of cases significantly reported in our hospitals as some jurisdictions may have experienced.
Thank you very much.
Jack, did you have any questions for the county executive?
No, I think that answers it. Thank you.
Okay, wonderful. Thank you. I do not see any more requests for questions from the members of the media. Going once, going twice. Okay, I guess that's it for today. Thank you, everybody, for joining us. Stay safe, and we'll see you again soon. Good afternoon.
Thank you all.
37,000 square feet.
I just want to say, government workers tend to get this bad rap. You're a bureaucrat. You work at a desk, you do a job, you push paper. People are as passionate about what they produce as just sitting in the desk doing the job. You don't realize how many of the staff, and I learned this a long time ago when I walked into a federal office building and started talking with staff workers,